All right, I think I found a good spot. It is very difficult to find a spot that I can comfortably be and record this video without having a lot of crazy light and stuff going on or risking dropping my phone. So hopefully the camera doesn't drop while I make this recording. Anyway, good whatever time it is you are watching this. My name is Bree, aka the Bionic Athlete, and today is going to be an episode of Coffee Talk where I drink coffee and I talk. I am officially 4 weeks post-op today, and despite the cheery sounding voice that I have, it's been kind of a roller coaster of 4 weeks, emotionally and physically, mentally, just everything. So I'm going to dive in a little bit about that, talk a little bit about my progress, because this is the first video I have made since my surgery. And if you haven't seen that video, I suggest you can just pop on over or watch it after this, or do whatever you want, completely ignore it. I don't really care. It's up to you. If you enjoy these videos, I'm going to say it right off the bat so I don't forget. Please give it a thumbs up, like, share, subscribe, whatever it is that you're supposed to do. Go ahead and do that now. So anyway, I am, like I said, I am 4 weeks post-op officially today while I'm recording this video. And it has been kind of like I said, a roller coaster. So let's dive into that. So real fast, just a quick rundown. So the surgery, overall, the surgery went well. If you didn't watch the other video, that I talked a little bit more about it, it was a minor revision, thank goodness. But I did have some blood pressure issues, at least that's what we think it was, after the surgery. So I had a couple blacking out times, once in the hospital, and then I think 3 or 4 more times once I got home. So that was a little bit scary, but my blood pressure got regulated, everything else kind of calmed down, and things seem to be progressing rather well. I had the posterior approach to go and do this revision, which means my restrictions for the first 3 months are you can't break 90 degrees with your hip. So that kind of limits the things that you can do. It kind of takes away some of your independence. Like if you have things low to the ground, if you end up dropping something, it's very frustrating because you can't just easily bend down and get it. You have to be careful when you're sitting. You have to be careful when you're moving your body around. It's just constant. It's just a constant reminder that you went through something. The pain goes away pretty quickly, or at least it did for me, I should say. My pain went away pretty quickly. It's more just always constantly being hyper aware of what I physically am not supposed to do, because I don't want to accidentally dislocate. Like I said, with my back surgery, I've mentioned this before, I have a higher chance of dislocating these first 3 months. So I just have to really be cautious and aware. But other than that, like I said, the healing's going great. And I contribute that to a lot of, just like how I was before surgery, physically and stuff like that. And then what I did to prepare to get me to be at this spot. And that is something I kind of actually wanted to touch base on today, was just talking about like the comparison process of your recovery if you're having a hip surgery or any kind of surgery or recovering from injury, and how to not compare your journey with somebody who's having maybe the similar type of surgery or has a similar injury, because even though it may be similar, there's always something a little bit different. And I want to discuss a little bit more about that in this video, because I think that's been the biggest hurdle that I've had to go through during this time. So anyway, let's talk about the comparison. And this is hot and fresh, so that's even better. Anyway, so comparison, what do I mean when I'm talking about like, let's not compare your journeys? Like, isn't it better to try and find somebody who had the same injury or surgery and like reach out to them to, what did they do? How did they get better? How are they recovering so quickly? Yes and no. And remember, this is just my personal opinion on this. Like, take it with a grain of salt, disregard it, do whatever you want. But anyway, so it's kind of a yes and a no. So yes, it is really good to reach out to somebody who is in a similar situation as you, because that gives you somebody to talk to. They can understand and relate a little bit more about, you know, how hard things are, about the pains you might be going through and the journey in general, versus somebody who's never been through it. They might not understand it, and it's harder to reach out and like tear down the walls of emotions and everything else and talk to them about it. So yeah, in some ways it is good to reach out to somebody. However, it's also really important to know, what was their life like before the injury? What's their full story? What approach, if they're having a surgery, especially I'm going to keep going with the hip replacement because that's my current surgery. What was the approach? There's more than one approach when you're having hip surgery. You have the anterior approach, which is an incision in the front. You have a lateral approach, which is closer to the anterior approach, and then you have a posterior approach where they actually are cutting deeper into the glute area. All three of those have different recovery times, different restrictions, especially for the first 3 months. When you get past 3 months, things are pretty much equal and about the same. So you want to make sure you know what their full story is, you know, and that includes beforehand. I personally was able to be still very active before I had my surgery, and that allowed me to build up strength, and that strength allowed me to have more muscle mass and everything else going into the surgery, which has allowed me to have an easier recovery time. Now, somebody else who has hip issues, they physically might not be able to do the workouts, the running, the lifting, whatever, to build muscle endurance and strength in that area. And their recovery time is going to be a little bit slower, and it's probably going to be a little bit harder just because that muscle wasn't there to start with. So they're starting and building all over. The good news is, hopefully, after they had this surgery, the pain that they were having beforehand is gone, or it's less, and that's allowing them a chance to now build up the strength that they need in that side of their body. So again, journeys are different. The reason why I bring this up is I was trying to follow some hip replacement groups and stuff like that on Facebook, and I was really finding them frustrating because people were looking for medical advice. They were looking for like, oh, this person's doing so great. How are you doing so well when I'm stuck in this situation? People are make comments about, oh, well, I was able to at 2 weeks go out and do this, and at 3 weeks I could handle this, and I'm back to running, and I set a PR at 3 months and stuff like that. Great for those people, but they're not talking about what their life was like before the surgery. They aren't talking about their surgical approach. They aren't doctors, and they shouldn't be giving this type of medical advice that they're saying, this is what I did. You need to talk to a professional about those things because it's setting you up for injury. And I followed those groups the first surgery I had, and let me tell you, it mentally was very tough to deal with. So the comparison process, I've talked about comparison in other videos and stuff like that, and I just really want to talk about it more today, and I just thought I would address it. This is going to probably be a long video of me babbling. You're welcome. It's been 4 months of me in my house for the most part. Anyway, so I post a little bit about how my journey is going. I don't get into full details. I'm not going to get into a ton of details about like how far am I walking. I'm not going to get into details about what my full physical therapy approach is. I'm not going to talk about my nutrition super in depth because everything is tailored to me, and I don't want to set somebody else up for failure or to feel like they're not doing enough. But I will happily share little bits that I can. I am walking. I am thankfully without assistance at this point in time. When I'm going out of town or away from my house, I still will carry my cane with me. I don't necessarily need it, but just in case, I bring it with me. If I'm inside a store, for sure I'm bringing it with me because there's more hazards there. That doesn't necessarily mean I need it, and it's kind of like a security blanket at this point for me. But there might be some other people who are still using it a little bit more. Actually, when I had my anterior approach, I used a cane up to, I think, the first month and a half or so of surgery, where some people, when they had the anterior approach, they didn't use anything. So everybody's journey is different. And I've been slowly building up my my time walking. I'm slowly working on building up some of my PT stuff, but I'm doing this with the guidance of somebody else, and also remembering where I was at before I had this surgery. So don't get discouraged out there. Don't compare your story to somebody else's or your journey that you're going through. Remember, this is yours and this is your time. Things are going to get frustrating. You're going to get angry. You're going to get upset. You're going to lash out. Those are all okay emotions to have. And, you know, I'm personally trying to find another outlet for these emotions, so I have somewhere to put them. So I'm starting to journal. But I don't want to just journal and write down all the negative garbage that's happening or going through my mind. I always end my journaling right now with 3 things that I'm thankful for. So that way I'm not just like spewing out all the toxic, but I'm also like reflecting on the things that I am thankful for. So anyway, things are going good. I'll probably not do another video until roughly 6 weeks after I have my doctor's visit, because like I said, there's not much going on. This is a big surgery, and my body needs that time to heal and recover. So really all I'm doing is just easy walking right now and doing some PT and trying to not go completely insane, being cooped up in the house. And right now we're supposed to have a huge snowstorm hit, so I probably won't be going even into town for at least 4 more days. That's okay. I'm thankful for my treadmill today. Anyway, I hope you guys all have a good day. If you stuck around listening to me babble, I hope it made some sense. And I really do hope that these babbling moments, these whatever you want to call them, times of chat, they reach you, they help you, or maybe they're going to help somebody else. If not, you know, whatever. I'm still going to use it for my own personal therapy. Cheers.